I didn't do this surgery in July, I wouldn't even want to get off my chair. I wouldn't even want to get out of the house. I was tired even just getting up out of bed. And now I'm ready to go. 5 o'clock in the morning, the alarm goes off, we're up, we're out, and we're going down to feed some horses and do stuff that we both enjoy every day. We have a little bit of a story here. Myself and my husband, Michael, he was wounded in Afghanistan in 2008 on September 24th, and that phone call changed all of our lives drastically.
My Humvee got hit by an IED, an improvised explosive device, and I ended up as a double amputee, lost both legs. It was September 29th by the time I got to Walter Reed Army Medical Center, Washington, D.C. My fiance at the time, Dawnalee, was there waiting for me. On October 2nd, we got married in my hospital room. When I was deployed and at the hospital, it was tougher on her than me.
46 surgeries later, and he came home in 2010. We had a long uphill battle, reintegrating back into civilian life for him, our home, our lifestyles, just trying to find a brand new normal, if you will. All my girls were in college, and I just kept putting myself last, and then pounds just kept adding on. 10 here, 15 here, 10 more, 20 here. And soon enough, it was out of control. So out of control that you give up.
So after taking care of me, the 3 girls, it was her time.
I'm going to be 53 years old, and I decided that with everything that's happened in our lives here, that it's my turn. I've had all my children through South Shore Hospital, so I looked into the gastric bypass surgery and found Dr. Neil Goucher. I clicked with him right away. I just thought he was very personable. I also think that all of his staff is the same exact way. I mean, they will help you any way you can.
There's a lot of preoperative and post-op.
One thing I emphasize from my information session to my first visit to all the visits that surgery is not a cure. It's not a standalone proposition, and it only works for the patients that are really ready for it and they're ready to make all those other investments, both emotionally, psychologically, physically, in terms of exercise, nutrition. So all those components get emphasized along the way because they're so important to have success.
All patients are required to have a one-on-one nutrition appointment prior to surgery. After surgery, it's required that they make some lifestyle changes, and there's a series of diet stages that they have to go through as well. In those follow-ups, it's our chance to check in, make sure that they're committed, they're following the goals that we set in that first appointment, and just to make sure that they understand what's going to be expected of them long-term.
Any questions about stage 3B and advanced?
The thing that makes me want to keep doing this and keep showing up is hearing those stories of, I haven't worn these clothes since my wedding. I haven't felt this good since I was in high school. I went kayaking. I haven't done that in 20 years. I went hiking. All these things that you take for granted, I think, and the fact that they're able to re-engage with that is things that they never even considered that.
When we were looking at property for homes for our troops and we came upon this piece of property, I just knew that Michael coming here, being able to see everything that's here and out the back, and being able to just go out, have a cup of coffee, see the wildlife, settle in, and just knowing that one day that I could have horses again, once we got settled and everything else was good, I could see it all in a vision, hopefully, that was gonna come, but I knew I had a lot of work to do.
Probably within a month of moving into the house, what I'd like to do, this here, that there, she had it all laid out in her head. She knew that because of my situation, I'm only gonna be able to do so much. So she got it in her head. She wanted to make the change, and she did.
Well, when I started this weight loss journey, I weighed 284 pounds. 6 months out, and I am down very close to 100 pounds.
So when I'm seeing patients 2 years out from surgery, 3 years out from surgery, it's rewarding for me because I get to see them go through this transition and maintain that transition.
Just to see her willpower and her drive to do it makes me want to do a little bit more. So I'm actually losing weight myself.
My Fitbit has been going off since 10 o'clock in the morning every single day, hitting my goal of 10,000 steps, so I'm winning.